There are several minimally invasive treatment options for BPH or benign prostatic enlargement. The aim of these treatments really is to provide a significant improvement in the way that men pee, so to improve their urinary symptoms in a way that is as durable as can be expected, but have a lower side effect profile when compared to standard ways for managing BPH. The historical paradigm of taking medication for as long as it works or until men develop side effects and then being offered a TURP really is a thing of the past. There are a whole host of different minimally invasive treatment options to manage symptomatic urinary issues related to a benign enlarged prostate. Hi, my name is Dr. Charles Chabert. I'm a urologist and the director of the Prostate Clinic located on the Gold Coast in Queensland, Australia. In this video, we're going to take a deep dive into aquablation. Aquablation is a novel treatment for the management of significant urinary symptoms related to BPH. As always, please, if you get benefit from this video, consider subscribing, give the video a thumbs up. And as always, if you have a comment or a story that you'd like to share, please leave it in the comment section down below. I do my best to get back to all comments to try to engage viewers so that we may develop some of the discussion and all learn together along this journey. So what is aquablation? In essence, it's a novel therapy to manage urinary symptoms related to a benign enlarged prostate. In essence, it uses an automated robotic type system to deliver high pressure water jet to the area of overgrown prostate tissue with a view to try and unobstruct a man's bladder, resulting in improvements in flow and resolution in bladder irritative symptoms. The procedure is performed in the operating room. It is carried out under a general anesthetic, and the procedure itself is guided by a combination of both real-time ultrasound as well as cystoscopic visualization. In essence, what that means is that we have a camera placed through the urethra inside the prostate and bladder to visualize what is going on real time, and there is a ultrasound probe that is placed into the bowel to facilitate delineation of the prostate, and in a programmed fashion, we can determine the tissue that needs to be removed from the overgrown prostate. During the planning phase of the treatment, in essence, a volume study of the prostate is performed, and this is determined really by the ultrasound probe. The areas of overgrown tissue are highlighted, and then these specifics are programmed into the tool so that we can program removal of the tissue. Now, one of the advantages to aquablation is that the areas that are involved in the delivery of ejaculatory fluid can be spared. So this part of the prostate is called the Veromontanum, and a Veromontanum sparing procedure can be carried out with a view that there is a lower incidence of ejaculatory dysfunction when compared to other forms of cavitating surgery, such as a TURP, a HOLEP, or a green light laser prostatectomy. One of the original studies looking into the efficacy or the effectiveness of aquablation was called, appropriately enough, the water study. In essence, it was a double-blind, randomized control trial involving just under 100 men. They were separated into two groups, one of which had a standard TURP and the other group had treatment with aquablation. What they found was that in the group that underwent aquablation, there was a bigger improvement in their urinary symptoms than compared to the group that underwent a TURP. The way that was assessed was with a questionnaire called the International Prostate Symptom Score. It's a self-administered questionnaire that has been validated in our industry to try and assess objectively someone's urinary function. People fill out that questionnaire both pre and post any intervention so that we can determine the magnitude and also the durability of any benefit that men get. So what they found was that the average reduction in the International Prostate Symptom Score in the Aquablation group was around 14.1 points. And when we looked at the group that had a TURP, that reduction was around 10.8 points. Now, if we look now at the need for re-intervention, and so this really comes down to the durability of the study, and there has been published 5-year follow-up from these men that were randomized into the two groups of TURP and Aquablation. And what they found was that the group that were treated with a TURP had a higher rate of re-intervention, whether that was with BPH medications or BPH surgery. The probability of requiring re-intervention at 5 years following a TURP was around 17.6%. And the probability of re-intervention, if you had aquablation, was far lower at 13.2%. Now, if we look in more detail with regards to these two groups, we can see that the surgical re-intervention was also significantly different between the two. Around 1.6% of people who had aquablation required a repeat operation, and around 3.1% of those individuals who had a TURP required reoperation within that 5-year period. So if we are looking at, is aquablation as good as current standards, the answer to that question is that within the limitations of that study, it appears as if aquablation can provide as good a benefit in urinary symptoms as compared to a TURP that appears to be at least as durable to a TURP. One of the big issues that many men are concerned with following BPH treatment, and really in my experience, this is what leads men to burying their heads in the sand when they're dealing with escalating urinary issues that are causing them more and more bother, but men tend to avoid addressing the situation because they don't want to run into the risk of having changes to sexual function. Now, to highlight, sexual function is two things. It's erections and it's also ejaculatory function. Now, many of the minimally invasive treatment options have next to no risk to erectile function, but can carry a very small risk of ejaculatory dysfunction. If we look at TURP, for example, some studies report up to 1 in 5 men can experience erectile changes. Now, in this current water study, there were no men that had a decline in their erectile function following the utilization of aquablation. If we look at the incidence of ejaculatory changes, now you may have heard of this term, it's called retrograde ejaculation. If men have a TURP, the probability of ejaculatory changes is really high, and it's at least around 80%. If we look at the incidence of ejaculatory changes, namely retrograde ejaculation in this water study, following aquablation, the incidence was around 15% rather than the almost 80% in the TURP group. The original water study concentrated on prostates of between the volume of 50 to 80 cc's. A subsequent study, the Water 2 study, looked at larger prostates above 80 cc's, between 80 to 120 cc's. And in essence, the results of this trial demonstrated a very similar finding to the original study, in that the benefit from the treatment was significant, as was the durability for that treatment. And in the Water 2 study, at 5 years of follow-up, over 96% of men were free from requiring secondary BPH intervention in that trial period. And only 3.7% of men who were originally treated with aquablation who had a large prostate, as defined by the study inclusion criteria, needed repeat surgery within that 5-year period. So, in essence, what you can see is that aquablation really is a new player, relatively new player on the scene when it comes to managing urinary issues related to BPH. One of the advantages to it is that it appears to have utility across many different shapes and sizes of prostates. One of the limitations that we have with some of the more minimally invasive treatments is that their application for bigger prostates or more complex shaped prostates can be limited. Because aquablation actually doesn't use any heat at all, there is therefore no thermal disruption or potential damage to the adjacent erectile nerves, which are placed on the outer part of the prostate. And as a result of that, that's why we're not seeing erectile dysfunction in this cohort managed with aquablation. So the real potential advantage is that aquablation can provide outcomes that are consistent with the results that we see in men if they're having cavitating procedures, such as a TURP, such as a HOLEP, such as a green light. But the real advantage appears to be that those men that have aquablation have a lower risk of ejaculatory dysfunction. Now, one of the potential challenges with this treatment is the risk of bleeding following surgery. Now, the exploration and the utilization of laser when managing BPH was really driven through the exploration of trying to create cavity-like results with a lower risk of bleeding and a lower risk of transfusion. One of the potential challenges with aquablation is because there is no heat. And this is where it's the double-edged sword. Where there is no heat, there is no erectile dysfunction. But in the absence of heat, there can potentially be a slight increase in post-operative bleeding. That's what I think about aquablation. Please let me know what you think. If you've had experience with this, or one of your friends or relatives has been through this and you can share your experience with us, please leave your comments in the section down below. Until the next time, please take care of your prostate.